Hello, and welcome to the webinar on direct support professionals and the COVID-19 vaccine. My name is Chet Cheddar, and I work at the University of Minnesota's Institute on Community Integration. I'm also a direct support professional. It's important to me to be vaccinated and get my booster for myself, but also for the person that I support.
Hi, my name is Katrina Simons, and I also work at the University of Minnesota Institute on Community Integration. I use the PCA Choice program, and that means that I am responsible for hiring and coordinating my own staff. I am concerned about COVID and my family. My parents are almost 70, and I'm concerned about their health. We are here today to talk with DSPs about the COVID-19 vaccine and hopefully address some of your concerns you might have. Let's get started. Your work as a direct support professional is important. Because of the work you do, people with disabilities receive the supports they need to be employed, participate in their communities, and take care of their daily needs. DSPs also provide important supports to help people stay as healthy and as safe as possible.
Some of the people you may support may have an increased chance of getting seriously ill if they catch COVID-19. Some of the reasons include that adults with disabilities are 3 times more likely than adults without disabilities to have a serious underlying medical condition.
People with disabilities often have additional factors that endanger health, such as being overweight, having problems with their hearts, or having diabetes. Data collected across the country shows us that people with intellectual disabilities were 3 times more likely to get infected and hospitalized with COVID-19 than the general population. They were also nearly 6 times more likely than the general population to die from COVID-19.
People with disabilities may have challenges maintaining social distance from others for several different reasons. Some may live in group living situations or with their family members who could also be older adults. Many need support with personal care and or have difficulty understanding the need to wear a mask or maintain social distance from others.
People who have trouble understanding information or practicing preventative measures such as hand washing and social distancing.
People may not be able to communicate when they have symptoms of illness.
People who are blind or have low vision or who rely on touch or tactile information.
People who need alternative communication methods, such as sign language or Braille, may not have access to current information. Since the COVID-19 outbreak started, we've had some measures put into place to make sure we keep ourselves and the people we support healthy. You and the people you support may have been wearing a mask, social distancing as much as possible, hand washing and cleaning more frequently, regular testing and monitoring for symptoms, staying at home when you're sick, and getting vaccinated.
Getting a vaccine is one of the best ways to keep you, the people you support, and people in your community healthy. Getting a vaccine is a big decision, and there is a lot of conflicting information out there. You may have questions about how safe and effective the COVID-19 vaccine really is. In the rest of the presentation, we hope to provide information to answer some of the questions you might have about the COVID-19 vaccine.
Governments around the world contributed a lot of money to support the development of the vaccines. Vaccine researchers set aside their other work to focus on the COVID-19 vaccines. Usually when a new vaccine is developed, researchers don't have the financial support they do to do so much so quickly. The researchers have been working on developing vaccines for viruses that are a lot like COVID-19. So they found ways to use their previous work for the COVID-19 virus.
The vaccines went through several rounds of testing to make sure it was safe. Tens of thousands of people around the world volunteered to be in the studies to test vaccine safety and to make sure it worked.
All of the testing showed that it was safer to get the vaccine than to get COVID. If people receive the vaccine, they're less likely to get sick.
Not all vaccines work 100% of the time, and some people may still catch COVID after being vaccinated. People who are vaccinated are less likely to be very ill or die from COVID than people who did not receive the vaccine. The COVID-19 vaccine is an mRNA vaccine. Here is a short PBS video about how it works.
The U.S. authorization of 2 COVID-19 vaccines marked a turning point in the pandemic and vaccine science. These vaccines use messenger RNA, or mRNA, to deliver immunity. mRNA are short strands of instructions used to build proteins. it's impossible for these mRNA vaccines to alter our DNA in any way. Although that technology has been in development for decades, mRNA vaccines hadn't made it to market until now. There are a few ways to make a vaccine. Most use a version of the pathogen they are trying to protect you against, like the flu or measles, to trigger an immune response. You can think of vaccines like a biological wanted poster. They show our bodies how to recognize the enemy, an antigen such as a harmful virus or bacteria, so we know how to react if it ever shows up. Our bodies will be prepared to send T cells to attack infected cells, and B cells to produce antibodies, which neutralize the virus and prevent it from invading healthy cells. mRNA vaccines use innovative technology to deliver protection. If traditional vaccines deliver wanted posters, these vaccines carry USB drives with instructions that tell our cellular machinery how to print its own poster. In other words, they instruct the body to make its own antigens. In the case of the coronavirus, the antigen is the infamous spike protein that attaches to and infects your cells. These vaccines use mRNA, a molecule that our cells need to create any type of protein to introduce us to that spike. To start, researchers isolated the part of the coronavirus's genetic sequence that codes for the spike protein. Then, they put an mRNA molecule containing the code into a super tiny drug delivery system known as a lipid nanoparticle, which can enter our cells. Inside the cell, ribosomes use the code to create a protein chain that resembles the enemy, the coronavirus's spike protein. Those cells can then temporarily display a lookalike of that protein, which prompts our immune cells to respond as if it were an antigen from a traditional vaccine.
Getting the vaccine will not give you COVID. The vaccine does not have the live virus. Some people have side effects from getting vaccines, including the COVID-19 vaccine. Side effects include chills, body aches, tiredness, and a headache. Your arm may also hurt where you received the vaccine. These are all signs that your immune system is working and creating the defenses it needs to keep you from getting COVID. Symptoms can be managed by drinking fluids, resting, and taking a pain reliever. Most people do not get serious symptoms from the vaccine. You can have COVID and not feel very sick. You may not have any symptoms at all. It is important to remember that you can still carry the virus with you to your work as a DSP and everywhere else you go. You can spread it to others.
If you're vaccinated, you're less likely to pass the virus on to vulnerable people. Vulnerable people rely on your immunity to stay healthy. Even healthy young people with no risk factors can and do become seriously ill with COVID. Others may develop long-term symptoms from COVID even if they weren't sick. These symptoms can be bad enough to keep people from working and doing other daily living activities.
One reason people decide not to get the vaccine is because they were already sick with COVID. Here are a few reasons why it's still important to get the vaccine.
1/3 of people who've had COVID-19 never developed antibodies, meaning they aren't protected against getting COVID-19 again. Some of the people who didn't develop antibodies had mild COVID cases, but others had moderate cases of COVID. So the severity of your COVID case doesn't necessarily mean you've developed antibodies.
Natural immunity doesn't last as long as immunity from the vaccine. Studies have shown that natural immunity can fade in as quickly as 60 to 90 days. Vaccine immunity has been shown to last for at least 6 months for Pfizer and Moderna. The full length of immunity is still being studied.
You are more than twice as likely to be reinfected with COVID than people who have been vaccinated.
So it's important to get vaccinated, even if you've already had COVID-19, especially if you have post-COVID syndrome or long COVID. As soon as you recover from COVID-19 and are no longer in quarantine, you can get vaccinated.
The vaccine doesn't stay in your body for more than a couple of days. It teaches your body's immune system how to recognize the virus and then leaves your body. The vaccines are fragile and break down easily. That's why they had to be frozen at such cold temperatures during storage. The The vaccine doesn't travel around your body. It mostly stays near the place that you got your shot. And it's important to remember that COVID-19 can have long-term effects called long COVID, even in people who didn't have a bad case of COVID. It can affect people's lungs, heart, blood vessels, and even the brain. People who aren't vaccinated are at a higher risk of getting long COVID.
Getting COVID-19 while pregnant means you have a higher risk of miscarriage or early delivery. Pregnant and recently pregnant people are more likely to get severely ill with COVID-19 as compared with non-pregnant people. There is no evidence that the vaccine makes people infertile. More and more information about the COVID-19 vaccine and pregnancy has been collected. These data suggest that the benefits of receiving a COVID-19 vaccine outweigh any known or potential risks of vaccination during pregnancy. If you have more questions about getting the vaccine, talk to your healthcare provider. You can also find information about COVID-19 vaccines at vaccines.gov. Text your zip code to 438-829 or call 1-800-232-0233. Thank you for your time today.